body is a urinary tract infection. Yes.
So is a UTI viral? Is it bacterial? Is it fungal?
Majorly, it's bacterial. It's not viral. UTIs are mostly caused by bacteria. One is called the Escherichia coli, or commonly abbreviated as E. coli. It can be caused by Proteus. It can be caused by chlamydia and other bacteria. Yes. Once they get into the UTI, into the urinary tract system, they can cause an inflammation, or they can cause a disease as such, and cause what in general we term as a UTI.
So these UTIs, who is at danger?
Anybody, as long as you're predisposed to the organism, or you are predisposed to any activity which puts you at risk of getting that bacteria, you get a disease, irrespective of the age and sex. Though women are at higher risk of having UTIs compared to the men, for the reasons we shall give later.
What are the symptoms? How do I know I have a UTI?
How do you know you have a UTI? This, in the first case, will depend on which part of the urinary tract system is affected. One, because if it is the kidneys affected, then you may develop some pain around the upper back, because our kidneys are found at the back.
At the back,
yes, exactly. So in case the UTI has affected that particular part of the body, then you may feel such kind of, you may have that symptom. Secondly, you may have nausea, general body weakness, general body pain, and others, but based on where the infection is at a particular time. Yet, if it is in the bladder, and maybe around the bladder, you may feel some lower abdominal pain. You feel pain which may sometimes radiate to the back, but it is just a result of the UTI you have. Then if it is in the urethra, you feel pain while passing out urine, some burning sensation as such. You may have a discharge, a white discharge, pass out offensive urine with a bad smell, or you may pass out turbid urine or cloudy as such. Sometimes the urine could be Coca-Cola color. So all those are signs and symptoms. Yes, but it could depend on which part of the urinary tract system is affected.
So when someone comes to a hospital and you're going to start doing their investigations, can a UTI be found in blood? Can it be found in stool? Can it be found in urine? What examination is done?
Now, for UTIs, the principal test or the principal sample that we would go for is urine, because we are talking about the urinary tract infection, which is actually getting its name from the word urine. So our major sample will be a urine sample. That's majorly we are going to look. Though sometimes we go further to pick even other samples, like we can choose to go and pick a high vaginal swab and make a gram stain, and we look at it, or even do culture on the sample. But in circumstances where these bacteria have overgrown and maybe penetrated the tissues and gotten into blood, then you could get what we call the bacteremia. These bacteria can get into blood. Yes.
From the urine?
Yeah, from the urine. There's a possibility after inflaming the lining of the area where they are, they could penetrate into the tissues and definitely into the blood, and they get into the blood circulation. Yes, so there's that possibility. So at the same time, we can still see the bacteria in the blood.
Okay, when the specific bacteria are present
yes.
in the blood,
yes.
you can still know if there is a UTI present
no,
in the body.
Actually, we don't do a blood test to diagnose a UTI.
No, I'm just saying if those bacteria that cause the UTIs, are found present in a person's blood, can you use that as a spark of that maybe this person has a UTI?
Actually, by the time it gets into the blood,
It has gone.
that is a severe UTI. And by the way, it is very, very dangerous when these bacteria cross into the blood. Those are severe states. When these bacteria get into the blood, it is more serious. Very, very serious indeed. So it is even a rare case that these bacteria get, because before it gets there, you'll be discomforted and definitely you have thought help getting that. So these are rare cases where these bacteria like the E. coli, Proteus and Klebsiella penetrate the tissue and definitely get into blood. Yeah, but that possibility cannot be ruled out. Yes.
So for how long can someone say, if I got the infection, for how long can I live with it before the symptoms or any discomforts come along for me to go to a hospital?
That is subjective to individuals, and there is no specific time that we can say that at either 3 or 4 days or a month, that's when somebody will get symptoms. But as long as there is an irritation, you know, most of the times we recognize these signs and symptoms when these bacteria have multiplied enough, invaded maybe a bigger area of our body and caused some substantial inflammation that causes some pain or itching that we feel. But you may feel some mild and minimal signs and symptoms which could be ignored. Because like I always get clients coming and telling me, I had maybe somebody had some sexual intercourse with somebody, but I'm feeling some mild itching. I don't know whether I could have gotten a UTI from this person, you know. But as the invasiveness goes on, as these bacteria multiply, because these bacteria multiply at a very high rate, you may find that for them, they need seconds, not a month. They need seconds to multiply for the cells to divide. So when the cells divide and then the invasion is gross and there is a high level of inflammation, that's when we begin feeling the signs and symptoms. But doesn't mean that before that point came in, that there was no bacteria in your body. It wasn't.
That's what I was even going to ask. At what rate do let's say bacteria or fungus or viruses, at what rate do they multiply? Because you could find someone who do a test today and then let's say they'll tell you have 10 to 15 epithelial cells, and then after 4 weeks they tell you have numerous, or let's say after 4 days they tell you have numerous epithelial cells. So the rate at which they multiply, how can it be?
No, they multiply at a very high rate because these cells really divide at a very high rate. They need seconds, not hours. They don't need months for the cells to replicate or to divide. Because how these cells grow, they just divide. It divides in 2 parts, and the other part becomes a bacteria on its own, and the other part also gets into another independent bacteria on its own. So the rate of division is very high. You get today to the hospital and you could have, just like I've said, you have a few pus cells or white blood cells as such, but by tomorrow when you get there you have greater than 100 per field. Yes, because the rate of multiplication is very high. Yes.
So what do these things feed on?
Oh,
I would ask, because I mean, why would a bacteria come into my body? What does it feed on?
Just
how
like
does it thrive in my body?
Just like you feed on food for your survival, even these organisms, they also feed. Some organisms in the body, they feed on blood. Some organisms feed on other body fluids. And our bodies have sugars, glucose. So they also enjoy that glucose. It is food
To
both
them.
for the body and even to them.
Can't they get it outside our bodies?
Sorry?
Can't they get it outside our bodies?
They can't get it out of the body, but they need that optimal temperature, which is produced by our body for them to survive. It could be too harsh outside for them to survive. That's why you see that for example, an HIV virus, it cannot survive outside the living cell. The moment it is outside the living cell, it will die immediately. So it needs to be inside your body and inside the living cell. Your body provides the optimal conditions that it needs for it to survive.
Wow, interesting. When we look at UTIs, at times we cannot run away from candidiasis or candida, like people call it. What is candidiasis?
Sometimes people misinterpret candida. They think candida is a UTI, but candida is not a UTI. As much as not far different from the UTI. We say these bacteria which are causing majorly the UTIs, but when it comes to candida, it's caused by a fungus and mainly the yeasties. So candidiasis is an invasion of your body with the yeast cells or the fungus as such. Yes. And still in this case, just like we said that women, still even in the case of candidiasis, they are at higher risk, yes. But this doesn't mean that men don't suffer from UTIs or don't suffer from candidiasis. They do. But women are at higher chances. Yeah, they are at high risk. Why? But if somebody is asking why before you get the rest, somebody needs to know why are we saying women? Anatomically, how we are created, it gives we men an advantage of not easily contracting such infections, because you may find that these two are related to person hygiene. And in this case, I'm not saying women are not hygienical, okay?
I think they are more hygienic than even the men.
Yes, if it is true, because
I think it is personal.
Exactly, it is on a personal basis. But generally, I may defend women. Women always want to look cute, to look beautiful, so they always care about their look compared to men. I'm one of those culprits who doesn't mind whether I smear my face with any Vaseline or not. Actually, I don't have any. Yes, naturally, I just bathe and walk. I don't apply any cosmetic on my body.
So when God was creating a man, he knew some of these things men wouldn't.
Yeah, but women pay much attention to how they look, to their hygiene compared to men. That's a fact. Yes, but now we go to these bathrooms, to the toilet. Some are used communally and we don't know what's been there. And for us men, if I'm going to pass out urine, I will stand and then urinate and pass out my urine. And then for women, you need to get down squat, which brings you closer to either the toilet or the infected. And that splashing, they may have a spilling back of the urine into private parts, and they carry along with either those fungus or the bacteria. So one, that puts you at high risk of getting the infections compared to men. That's one. Then secondly, when you talked about this bacteria like the E. coli is majorly found in the GIT, gastrointestinal system, the GI system. That's the one which is responsible for stool, because these are enterobacteriaceae, or organisms which are found in the GIT. So how do they again easily get into the urinary tract system? Now, anatomically for women, you'll find that the anus and then the urethra are close to each other. The distance is small. So there are high chances of those organisms easily crossing from the anus to the side, and then you get a UTI. Yes, that's one. Then other predisposing factors, now like it is common in women who are pregnant because of hormonal changes. hormonal changes will predispose you to easily getting infections now like candidiasis. Because when there is an increment in some hormones like estrogen, then it makes your body prone to getting this infection. By the way, when we talk about these organisms like candidiasis, these fungus or these fungus, we stay with them normally. They are all over our body, in the mouth, in the GIT, in our private parts. They are there. But when do they become a disease? They become a disease when there is an overgrowth. Because we have bacteria and the fungus on our bodies, but they control each other. They regulate. The bacteria regulate the growth of the fungus, even the fungus regulates the growth of the bacteria. So they keep themselves naturally at a level which is not bad, which cannot cause a disease. But should they be a circumstance where there is an overgrowth of the other, like most likely an overgrowth of candida, that's when we get the candidiasis. Yes. And now when it comes to women, because you always want to be concerned about your health, sometimes you make mistakes, like what you call dodging. You sometimes want to clean, most especially your private part, using some detergent, some fumes. So when you do that, you may kill or remove much of the bacteria. Yes. So when you leave the fungus probably alone, then you have created an imbalance which will result into the overgrowth of the other, and definitely you have candidiasis. Another factor which may lead to that is use or misuse of the antibiotics. Because when you use these antibiotics so much, they will kill the bacteria. That means the other imbalance. Yes. So there will be a surge in the growth of the fungus, and definitely get candidiasis. Another factor is to do with the immune system. People who are immunocompromised,
Looking for a place to professionally learn and master beauty, cosmetology, hairdressing and cutting? Go to Jefferson's Bridal Academy. We offer intensive training and internship for both students and adults. Call us now on 0776 766 268. Jefferson's Bridal and Beauty Academy. Exceptional and professional.
You're watching Rest TV. Wumula.
So welcome back from that short break, and before we get to the break, we were looking at natural remedies or treatments we can use at home to clear or to treat UTIs and Candidiasis. And we said when we come back, we're going to be looking at the medical bit of it. How can we treat it? Doctor, how long does it take for someone to get treatment or to be on a treatment course for UTI or Candidiasis?
It depends on the severity of the infection. How long it will be on treatment will depend on how severe the infection is, and secondly, the treatment you'll get also depends on. Yes, so we shall not give treatment on TV because we have not diagnosed anybody, and we don't want anybody outside there to hear this and then run very fast to the drug shop and like, I want ABCD. No. First go see your doctor. The doctor will assess you, see how severe the infection is, and appropriate, the doctor will prescribe for you what is best for you based on your condition. So that's what is going to happen. So for those watching us, we're not going to give treatment on TV. That's the first case. But how long it depends for somebody to get treatment, it will depend on how severe your infection is. Some people may take for a short period of time, and others will take long, but that will be upon the doctor's recommendation after assessing you and knowing that you need this for ABCD. You may probably need to be given IVs or injections as such. You may be given tablets, but the doctor will determine and in discussion with you.
Okay. Why don't men want to take treatment for UTI, actually, let me say for infections?
I'm not aware about that.
Because I have done some little research, and you'll find most times if a woman has an infection and she comes to a medical facility and they are treated and they are told, you know what, you have this infection ABCD, these are the medicines you need. Tell your partner to come to a medical facility or to go to a medical facility, get checked out and take this medication. Most of them report saying, God, that is going to be hard. That person is not going to go, or they'll even beat me, or they'll even. Why don't men believe that they also need to get treated?
Actually, I don't think that it is men as such,
or particular individuals,
but this is on particular individuals. Because I'm a man, and I don't find any difficulty if somebody called me upon to go for a medical checkup. I will easily run there.
Because you're a doctor.
No, but I've seen even someone with doctors. But this on the individual basis. But men out there, if it is true that that's what you do, then I call you upon to always endeavor to go for medical checkup. And most if it is your wife is calling you upon to go for a medical checkup, why can't you go? One, it will be the confidence between two of you as a couple. Because if you're my wife and I requested that we go for a medical checkup and you hesitated, it will bring a number of questions in my heart. I could be suspicious you're not honest enough, you're not faithful. But if you really you are, why would you hesitate to go with me? I feel it would be merrymaking when we receive our negative results and we share. Have mine, have yours. You see, they're all negatives. There's some bonding it creates. It builds trust and brings a stronger bond that you may not know. So men outside there, why can't you do that?
I don't know. I don't know.
To me,
I hope they are hearing that.
I just feel it is romantic enough.
The doctor says it is romantic.
Yes.
To get treated and to get checked. So please.
Yes.
So doctor.
Yes.
In the instance that you'll find in a home, let's say there are children and maybe you're using a bathroom or a washroom as a family, but you have your own, and you'll find that these young children keep getting recurrent infections. Yeah. How do you help a child? Because at times it's you who bathes the child. You endeavor to clean, by the weekly cleaning the washrooms, the bathrooms. You scrub them with all these necessary detergents and all that. But you find the infections are around there in the family or in the home, and they're not going away. What brings that recurrent?
Now, this is infections. What are you exactly referring to? Because infection is general.
Okay, the UTIs. I'm looking at the UTIs because you can find this kid, and you know, at first when we were growing up, we used to think UTIs are infections that are mainly for men and women who have sex. Yeah, so you find a young child going to a hospital, and they say the child does not have malaria, the child does not have typhoid, the child does not have this, let's check the child's urine. And on checking the child's urine, they tell you your child has a UTI. So you would keep wondering, because even now I believe there are people who still have that mentality. And you're wondering, how can my child have a UTI? How does it happen? So what brings that in the children? Would we say maybe their immunity is too low or something?
That's one of them, but just like we said, hygiene is key in managing these infections. So you need to keep a good hygiene. Now, for these children, even when you're not sharing the bathrooms or the toilets with them, it doesn't mean in their toilets they cannot get infected. No, that's not true. And secondly, these children of ours, they are always playful, because we do not only get these infections from the toilets as such, but even outside where they play from. They sometimes sit down without to pants, even sometimes, because they are kids. They don't know what the effect could be, the outcome. So one, as a parent, you also need to monitor how do your children play and who they play with. That's important. Apart from only maintaining your toilets clean, what about outside? Because you don't just keep them locked inside the house. They move out, and who they interact with, what they interact with, where they play with, from, and what they play with also matters. So you need to keep a keen eye on everything if you keep your children free from such infections.
So in the case someone has come to a hospital, because you said we have these bacteria and fungus living on our bodies. How does it get to the mouth?
How does it get oral? You know,
that oral.
How we get infections. By you talked about oral candidiasis. Candidiasis can also be in different, just like you talked, and just like you said, the oral candidiasis, that's the candidiasis we find in the mouth. If it is on your private parts like the vagina, that's we call the vaginal candidiasis. And any other part of the body, it can be there. It's not restricted only there, but it can be any part of the body, in the eye, in the nose, in the intestines, anywhere. On the feet, on the body, the ones we call ringworm, all those are funguses. Yes. So it can be any part of the body.
So how would you tell? Because you see at times people get what do they skin infections. I would say, maybe let me call them skin infections, but that is something else altogether. You'll see something like a ringworm patch, or what is this thing called? What is olumu? What is olumu called?
That's ringworm.
It's ringworm. Then there's that ringworm patch, and it keeps growing. And even when someone maybe applies medicine they've been given from in the hospital and all that, it keeps growing and it keeps growing. Now my question is, at some point, are these things chronic?
No, they're not chronic as such, but in some cases of reoccurring, because there's a possibility that the fungus or the infections will reoccur, because they have microscopic spores which cannot be seen with the naked eyes. I get that. And most times when we take this medication, the medication will work on the vegetative part of this fungus.
It's been predisposed.
No. These fungal infections, or the fungus itself, it exists majorly two forms. We have the spore form and then the vegetative form. I don't know how best I can break it down. But now the spore forms like a capsule. It has a capsule which is hard, which can not be easily penetrated by the medicine or the drug as such. It is resistant to high temperatures, so it can withstand harsh conditions. But the moment it germinates, or it turns out into what you call the vegetative form, the ones which we sometimes see causing now the infection, that is when it can be easily worked on. But the spores are resistant, and they could even be resistant to some drugs. So the reason for it reoccurring is that when you treat, and probably the vegetative part is done away with, but spores remain, they may germinate in, if we,
so your treatment
we state
has
it like
to
that.
target treating the spores.
Yes, that's why it may not be specific on that. That's why we always advise people that irrespective of what you know, it is advisable to go and seek guidance from a doctor. Fine, there are many creams, tablets, injections to deal with the fungus, but these fungal infections are categorized. They have different types. Yes, ringworm is different from oral candidiasis. Are you getting that? The treatment you would take for the ringworm is not the same. Are you getting that? And it's not, it wouldn't be the same that the doctor would possibly prescribe for you for vaginal candidiasis. So it is better you go and seek advice from a doctor. The doctor will look at what your problem is, or if you have a ringworm, and it will be at a proper position to see how best to help you. We can even have fungal infection of the nails.
I've seen people that have nails that fall out.
Yes, sometimes they break, they become hard, they have lines. When you have fungal infection, your nails, your fingernails become brittle. They can break in time and hard, and can be deforming. You get these fingernails deformed. So what will you do? Seek guidance from a doctor. Yes, don't look at what a neighbor used. You say, I had the fungal infection and they used ABC.
I was given this car cream.
No.
So you go and buy it.
There are many creams with different contents. Yeah, there are many different ingredients. I mean, active ingredients in those tubes that we call tubes, those medicines for different diseases. So it's better to do everything to apply any tube on your body, on your infection, based on the doctor's recommendation.
Now, I think oral candidiasis has symptoms it presents.
Yes,
right?
definitely.
How do I differentiate oral candidiasis from an ulcer of the mouth?
From an ulcer of the mouth. One, when it is candidiasis, the sores which are in the mouth, they are always white in color. Yes, they are always, when you look at them, they are white in color, or they have that white coating or lining. Then these other sores are reddish, but that wouldn't be a conclusive issue. You shouldn't simply look at it. What if during the process of brushing you brushed off that
white patch,
and it remained a little bit red? Would you conclude? No,
you wouldn't.
Secondly, even the invasiveness of candidiasis is different from a mouth sore, because if it's just a mouth sore, you may probably find it in one spot of the body or two, but for candidiasis you may find it spreading on the tongue, up and lips. Yes. So how the invasiveness is more serious compared to the mouth sore.
Because at times, like let me say, at times there are people who get a wound on the mouth, and most times, here in Uganda, I don't know in the other parts of the world, but most times I don't know how that is associated till this day. It's my understanding. But
I even have a message on my WhatsApp here. Somebody sent me a message and was because he was telling me I had malaria, and he was telling me malaria is going through the wound. Just like I said, because I was advising him to go for a medical checkup, and he said,
and at that point I think they feel they are
that is not true. You need to get treatment, because for malaria, that's a parasite in you, and you take a treatment and you get rid of that parasite. But that parasite can't get out of your body through the wound. That's not right.
So I would ask, what brings about those different wound patches people normally have on their lips?
It could be just an infection like we've been talking about, or it could be a sore. Sometimes we get bruises when we are brushing. Sometimes accidentally we bite ourselves, and it could be a point of entry of a certain bacteria. Yes.
And then you'll find someone having a serious wound around their mouth. I have a question here. Let me look at those ones we have not looked at. What is the best treatment for candidiasis? I think that we have looked at it. How does candida look like on the skin?
How does candida look like on the skin?
If I have a wound, let's say if I have a wound, or if I have an infection and it's on the skin, candida is on the skin, how does it look like? Does it look different from a ringworm or an irritated skin?
Actually, we cannot say how does candida look on the skin, because candida is commonly affect the what can I say? Candidiasis. When we talk about candidiasis specifically, it always affect our genitalia for such, like most especially for women. And the citrate, the species which is common for causing candidiasis or vaginal candidiasis is the Candida albicans. Fine, you can have oral candidiasis, and that's we discussed how it appears. But on the skin, we cannot say that we have skin candidiasis. No, and that's not right. But we have a fungal infection.
Fungal infection.
Yes, that's a fungal infection, because candidiasis is caused by yeast cells. So there are many types of fungus which affect different parts of the body, and that present with different signs and symptoms. Yes, we have different species of candidiasis. Like we talked about the yeast cells, we have those which affect the fingernails, we have that of the hair. Are you getting that? So it is not all called candidiasis. No,
those are just some, I think, skin infections.
Yes.
Okay. How often should someone go back for review? Most times they tell people you come back when your medicine is done, or come back for a review, and people normally dodge that. So when I have a UTI, let me say, and I come to a hospital and I am treated, what chances are there that the treatment will clear out all?
What again? That question. What?
I have a UTI. I come to the hospital and I get treated. Yeah. And after I get treated, how many times should I come for a review? Or what are the chances that the treatment I am given the first time, and I am keeping my hygiene clean and all that, what are the chances that the treatment I am given will clear out all the infection at a go? Or should I come back after the treatment to get retested and still given another dose of treatment or not?
Now, when you expect it to come back, that is subjective. When the doctor may determine how often or when you do come back based on the severity of your condition. If you need to be reviewed immediately or in a short period of time, then the doctor will tell you to do so. If the doctor feels you're better and you don't need to come back early based on his assessment, then he will. So there is no specific time that should be given to an individual that all people should be coming back for review in such a particular time. No,
but
there's
if
no
I'm
case.
a patient and I feel I want to go back for a checkup, it's okay.
You're very okay. You can come, you can go and see a doctor at any time as long as you're not feeling well. Yes. You feel free to explain to your doctor whatever your discomfort is. Yes, that's true. Then you said, what's the possibility that the treatment you're given
will flush out all?
Yeah, when we give you
the
treatment or when the doctor, no, that's another
not
misconception.
where and then, but okay, what I was saying, that's maybe let's say I'm given a treatment for 5 days. After the treatment of that 5 days, should I assume that now my body is free, infection free?
Yes, and that's also what I presume, that after you taking the treatment as prescribed and as told, you'll be free at the end of the dose. If I give you the treatment you're supposed to take for 5 days, I expect
that after those 5 days,
unless otherwise, maybe if you get reinfected, that's another thing. Maybe if you don't adhere to what I've told you to do and you don't take treatment as advised to, that's another challenge. But again, there is a possibility for some other people who have probably misused or overused some drugs, where there are cases of drug resistances. I could prescribe to you some treatment, but you may not respond to the treatment. Why? Because you became resistant, or the organism, the bacteria or the fungus you have became resistant to a certain drug. So in such cases, we need to do a drug sensitivity probably, or the doctor will prescribe for you some other drug different from what he had given you before, in case you don't respond to the treatment given to you earlier.
So I'm thinking it's also equally important for at least the patient or any person to have certain things at the back of their minds. If I go to a hospital and I have been taking, let's say, PCM or paracetamol more all the time, I should notify the person I am seeing, the medical person I am seeing. You know what?
Actually, those are some of the things when we interact with the patient.
With the patient.
Yes.
But you know, some of them don't know.
But if you don't know, because not everybody will know. But this is what I always advise my clients to do. When you're going to see a doctor, and most especially a doctor you have never met before, you're going to see a new doctor, you're going to a hospital you have never been, probably they don't have any of your records. It is always prudent to carry along with your previous medical documents, because the doctor will have to look through, see probably what you were diagnosed with, which treatment you've been taking for how long, and then see whether you're improving or not. The doctor will, based on that, either to continue with the same medication or to change. Because what you stated is very true. Not everybody knows that I've been taking chlorphenical. Not everybody can pronounce that word. Some people completely have no idea.
They'll tell you, I take there was given a white tablet.
A white tablet. It was in a blue pack.
In a blue pack, and yet the packaging keeps changing.
Yes, the package keeps changing. So when you're going to see a doctor and you've been visiting another doctor, it is good always to carry along with your medical
history.
documents. Yeah, because the doctor will have to look at your history and they know how to manage you better, either to continue or to make some changes.
And I think it also helps them better. Because, I mean, why would you start me on a treatment my body is resistant to?
Yes.
Other than going to something better.
And sometimes we end up doing the same things which were done. Like for investigations, you could have been tested for malaria and the malaria was not there yesterday, and then you come to me without any document. So I may take you through the same process, and if it is places where you're paying, then you keep paying money for the same thing which could not even be relevant at such a time. So it is good for you to carry along with your documents.
Okay.
It saves time in the first case, and saves money.
It does save time, money, and I would say even the psychological torture that comes, or trauma that comes along with it. You know, going to a hospital and you're given treatment, the same treatment, and you're not getting better is really frustrating.
Yes, frustrating.
Very frustrating.
And equally frustrating to us, the clinicians.
Because you would wonder, what am I not doing?
Exactly.
Right? Why did I miss out on this bit in school when they were talking about recurring symptoms and illnesses, you know? Our time has moved quite so fast, and I think we cannot take it on from here. But doctor, in a few words, one or two, give us closing remarks and maybe what we should look up to in 2020.
2020, I believe, is going to be a healthier year. I believe our viewers, including us, we are going to be more healthy. I really don't want to see you sick, because in these topics we keep discussing. By the end of the year, we shall be at a better placed position to maintain our bodies healthy, clean, and some of these infections that we get out of not maintaining our hygiene properly, social behaviors. I believe we shall be rid of them. We shall be at a better placed position to be healthy people, enjoy our lives free from disease, and spend less. You know, one of the factors which are making people not develop so fast is health. We spend a lot of money in the hospitals, the money which we would use to invest and do a number of things that would help our lives. But we keep taking that, like I said, kids to hospitals, infection every time. But you will continue taking them to the hospital, infection, if you don't mind about who they play with, what they are eating, where they are sleeping, where they are bathing from. You know, some of the things which we should really take notice about. So I wish you a happy new year 2020. Thank you for watching us today. Have a blessed day.
Okay, thank you very much, Doctor. The Bible says, my people perish due to lack of knowledge and understanding. And I think being ignorant is very, very bad. So it's very important for us to keep learning these things and know. And that way we are going to save not only our health, but save our money. Imagine the money you would use, that you use spending in a hospital, you would use for something else. So I encourage us, let's keep watching, keep getting knowledgeable of these things, and we live a better life. We love you and thank you very much.